Hi, I'm Alisha Kleindel, speech-language pathologist from Adult Speech Therapy. In today's video, I'm going to be talking about the Mendelsohn Maneuver. So the Mendelsohn Maneuver is a swallowing maneuver that targets increasing hyolaryngeal excursion, as well as targeting cricopharyngeal opening, or the UES. So to complete the Mendelsohn Maneuver, you're going to sit up straight and first just gather some saliva in your mouth. Place a finger on your Adam's apple or thyroid notch. Feel your throat go up and down. On the next swallow, when you feel your throat go up as high as it can, hold it for 3 seconds. And swallow. When I'm holding it, I'm squeezing the muscles in my throat as hard as I can. Again, from the side. I'm first going to just swallow naturally, feeling my throat rise and fall. On the next swallow, I'm going to hold it up at the highest point for 3 seconds. And relax. Try to complete that 5 to 10 times or to the point of fatigue. Good luck teaching your patients how to complete the Mendelsohn Maneuver. For everything else you need to assess, treat, and document, including free content and PDFs, visit adultspeechtherapy.co.